in the shapes that I like. And so these 3 shapes come on the kit itself, along with the 2 polishing wheels. And the same diamonds that you use to adjust Bruxer are the ones that you use to cut it off, which is the subject of what we're doing today. So we're going to use 2 of these, but there's a third one that I like. But I just want you to be familiar with these because you're going to have to order backups. These aren't going to be enough because, as you'll see in the clinical footage today, it's pretty easy to go through a fair amount of these diamonds when taking 2 crowns off. And the thing that's different about what I happen to be doing today when I'm taking them off is the fact that we're doing anterior crowns. This is actually the first time I've ever cut off some Bruxer anterior crowns. I've done posterior. So these burrs, when ordered separately from Axis, are just as known as Zercut burrs. And so that's the Bruxer kit, but these are actual Zercut burrs. And again, you can tell, as always, because of that blue stripe. And this is fortunately a convention that everybody seems to have adopted. So when you see a blue stripe on the shank of a diamond, it lets you know that this is a diamond that's been optimized for zirconia. So like a red stripe diamond is a fine diamond, about 60 micron diamond particles on there. And with these, the blue stripe, it's a range between 5 microns and 40. So this is the finest grit of diamond that we actually have today. And that's why it works well to adjust and remove Emacs, and even works well for adjusting regular ceramic materials, because it's very easy to get rid of the scratches when you polish it, because the scratches aren't very deep because of the small particle size of the diamonds. And the reason we use such a small particle size of diamond is because the particles, the Bruxer particles, are submicron size too, and so you need something fine to cut through it, even though it's a little counterintuitive and you would think something coarse would work really well. So this very first diamond, this is an 807018, and you might call it like a top hat diamond, like I used to do it before I knew it was the 807108. But it's got a flat end, and you'll notice that it's wider at the bottom and thinner at the top. And that's beneficial because it's going to help. It's got a nice wide diameter, and you'll see me using this as we cut through it. The one area of this where the diamonds get stripped off really quickly is this edge. As the vertical wall and the horizontal wall come together, this edge will get stripped very quickly. So we try to use that sparingly as we go in, and you'll see how we use this in the area down towards the gingival area of the tooth, but we don't really approach the gingival area with this. As you'll see, one of these burrs will go through 1 crown, maybe 2 crowns. I get about halfway through the second crown, I think, before it strips all the diamonds off there and it actually stops cutting. But this is one of the shapes that I really like. And so again, this was, I'll set it over here. This is an 807018, where 018 is the actual width of it, and 807 refers to the shape. And so we don't see that shape all that often in dentistry. But that's usually the first burr that I'm going to use, that I'm going to take to a crown, a Bruxer crown, whether it's anterior or posterior. That's going to be my first cut. Usually the second one's going to be with this one, a more traditional shape. This is an 878K021, so it is kind of a chamfer shaped burr. And you can see it's wider at the top and thinner at the bottom, but it's got that nice little point on it. And this is what I like to use to cut through Bruxer material right at the gingival margin. This allows me the best opportunity to be able to kind of sneak down into that area right by the gingiva without necessarily hacking up the gingiva while I'm trying to cut through the crown. The good news is, because it's such a fine diamond, if you do brush the gingiva, it usually will not cause as much damage as a regular burr will. Of course, if the gingiva is inflamed, any burr is going to cause an issue. But I will often take a retraction instrument, could be a cord packer or a composite instrument, and kind of pull the gingiva back a little bit to expose it. And you'll see me do that on the video to get in there with that. So that's the second shape that I have on hand. And I have, all these burrs in bulk, basically. So this is an 878K, which refers to the shape of the gingival margin, the type of margin that it'll make. 021 because it's 2.1 millimeters wide at its widest point up at the top. So these 3 diamonds, those 2 and the one I'm going to show you here, are the ones that I keep in bulk, because I work with a lot of zirconia and I'm having to adjust it. But I'm also having to cut it off, and cut it off mainly just because I want to test it and see how it works. As we make Bruxer more translucent, I always want to see if it feels any different when I go to cut it off. So kind of like the patient today. We put 2 Bruxer crowns on, and he knew we were going to cut them off and take them off again and then put them back on to see what it was like to cut off anterior crowns. So he gets the dentistry for free, and of course, as it turns out, there is no such thing as free dentistry. No cash is going to change hands, but he's going to have to go through a little bit of stuff that he wouldn't ordinarily. So this is kind of a football-shaped burr, although I prefer one for these purposes with a point on it because, again, this allows me to get very close to the lingual margin, the lingual gingiva, and be able to sneak under it a little bit if I need to without cutting into it. So my prep kit actually has a rounded football burr, but this one has more of a point on it. This is a 368-023 diamond. And so that shape's just a little bit different than the usual 379 football because it does have that point on it, which allows me to go right up against the gingiva and hopefully not brush against it. Again, you can use a retraction instrument if you want. And so as you'll see on the clinical footage, when it comes to taking off all ceramic crowns, it's a lot more work than the old PFMs were, and oftentimes we have to take off the facial portions separately from the lingual portions. And this is what I'm going to want to use on the lingual portion to be able to prep through that. Because of how wide it is, it really does a good job going through the bruxer. We're not putting a ton of pressure on it, but because it's nice and wide, it cuts well. The only thing that's going to get stripped is that tip right there, and so we use that tip sparingly down by the gingiva, and the rest of the time we try not to involve that tip too much if we don't have to. So again, that one is the 368-023. And so those really are the 3 burrs that you'll see featured in this, and these are the 3 burrs that I really order in bulk for the most part. I don't have a ton of the other shapes of the zirconia diamonds around, but these are the 3 that I keep on hand because I know oftentimes it's going to take multiple burrs to maybe get through one crown, but certainly multiple burrs to get through multiple crowns like we're doing today. So let's take a look at that clinical footage. This is a patient of mine who we're getting ready to send over to the periodontist, and he had 2 PFMs on teeth number 8 and 9, and I asked him if I could take them off and put on some bruxer crowns for the express purpose of cutting them off. So after we cut them off today, I'm going to put 2 temps on and send them over to my periodontist because my periodontist likes to see people with temps on because he likes to wiggle them off and really be able to work all the angles around the tooth. And so this patient was nice enough to allow me to do this. Once his periodontal situation is stable, then we're going to go ahead and place some permanent crowns. So this is an 807-018 burr that I'm using, or a top hat burr, I guess I would call it colloquially. And I'm using it up and down with light pressure. This is the key, is to let these diamonds do the work for you. Don't press any harder than you need to. And look, I've exposed a little tooth right there in the gingival third of the crown. That's what we're trying to do when we take off zirconia crowns, is just expose a little section of tooth and then unzip it from there. So I was thinning out the incisal edge there. I'm going to come back now and work a little more to widen that and just kind of pull it up with light pressure. You can get through it if you push too hard, but you're going to strip the diamonds and you might cause some damage to the tooth. So to get to the gingival, I'm pulling the tissue back with a composite instrument, and that's an 878K021 diamond. It's a chamfer diamond, but because it's, you know, a zirconia optimized diamond, we can use it with that tip. And see how I'm just kind of diving that tip in there? I kind of hold the burr there, get the tip where I want, and dive it in to try to use it with the least amount of pressure. And then I put my Christensen crown remover in, and we're going to give this a twist. And hopefully we're going to, there we go, it's starting to pop loose. And I'm going to reach in and try to remove this. And it's still wedged in there just a little bit. So one more twist. I really don't need to cut anymore because I've got movement. And I'll take this out, and here it is, the most depressing sight in modern dentistry. Half the crown still in place. And this is on with Ceramer cement, by the way. This is not bonded into place. And so I argue with a lot of my CEREC friends about whether or not these restorations like Emax or Bruxer need to be cemented or bonded. And I think this is a pretty clear example as you watch me cut off these 2 teeth that cementing these high strength all ceramic crowns into place is going to be enough as long as you have a retentive preparation. That's really the key. If you don't have a retentive preparation, it needs to be bonded. Well, now there's only 2 things to do. I could cut another vertical cut in the crown as I did, or I could go horizontal like I'm doing now. And so I'm taking that 807-018 burr and moving it horizontally. Those dark lines that you see there, and you can see the lines actually in the bruxer. And if you look at the tip of the burr as well, you can see that smooth, dark, kind of gunmetal gray area at the tip. And that's where all the diamond particles have been stripped off of there. So Now that's not cutting anymore, so I'm turning it sideways, trying to use a different portion, and that's what I'm able to do, and put the crown remover in and pop off another quarter of the crown, but I still have this whole gingival section left. So I'm taking my 878K021 again, just because I'm working in proximity to the gingiva. I want to have that chamfer diamond with that tip on it so I don't get in trouble if I approach the gingiva. Now I'm on the lingual. This is a 368.023 football burr, again a zirconia optimized burr. So when you see these burr numbers like 368.023, they will typically have a Z in front of it to let you know it's a zirconia burr. And when you look at it, you'll see a blue stripe on the shank, which lets you also know that it's been optimized for zirconia. And basically, I'm prepping away the bruxer material as though it were tooth, very hard tooth, albeit. So I'm using the football burr to take it off, because the football burr was what I used to prep the lingual surface of that tooth in the first place. So now we're going to move next door and go over to tooth number 8. And again, this is the 807.018 burr that's being used. The tip of it's not being buried too deep into the crown itself. I'm really trying to use the entire length of the diamond at the same time to kind of spare that end. Because here's where I'm going to use that end, is to use it as we get closer to the gingival margin, looking for the tooth. And again, once I expose a little bit of tooth, now I'm just going to start unzipping it, if you will, and not pushing down. Really, it's just the weight of the handpiece. Now I'm going to turn again and go perpendicular to the long axis, and then cut down through the incisal edge. That's a critical cut to be able to kind of pop this crown in half. If you get the incisal edge and most of the way down the facial surface as I've done here, that's usually enough. I didn't cut all the way to the gingiva because I want to show you that this material can be cracked with a crown remover, and that may be a little more force than you're comfortable with, and you may want to use that 878K021 burr to go all the way to the gingiva, but you don't need to. Again, we've got half a crown left, yippee. And so I'm going to take my 807.018 and cut horizontally. And look at that. I got lucky. I just had a quarter of that crown fall right off again. But now the rest of it's stuck and it's not even loose. So I'm back with that 878K021 in proximity to the gingiva, basically prepping through the zirconia oxide as though it were tooth structure. And look at that. I got lucky there, and another couple pieces kind of popped off as I was doing that. And so we used 3 burrs on the first tooth, and then we used 1 burr on the second tooth. We used a new 807.018, that top hat burr. So we used 1 on each tooth, and then we were able to use the same chamfer diamond and the same football diamond on both. So we went through 4 burrs to get 2 crowns off, which is pretty much par for the course for me. You can expect to use probably 2 burrs per tooth when cutting these off. So it's not impossible to cut these off if somebody has told you before that it is. It's certainly more difficult than cutting off a PFM and takes more time. Let the burr do the work, the weight of the handpiece, which is slight pressure from you, kind of going in stripes from incisal to gingival. Expose a little portion of the tooth, unzip it until you can see the rest of the tooth, clear the incisal edge, and then you're going to bust it into 2 pieces, and unfortunately, one of them is probably going to stay in place, and you can split that again, but then you need to prep the remaining segments as though they were enamel. So we've got these wonderful new materials that look better than old materials, and they're nice and strong. One of the downsides is they're more difficult to cut off, but if you have a zirconia optimized burr, you're going to make the job much easier on yourself and the patient.